Have you ever spotted a weird white patch in your mouth and kind of wondered, what is that? Well, you're definitely not alone. Today, we're going to break down something called oral leukoplakia. It's actually more common than you might think, and we're going to get into what causes it, what it looks like, and most importantly, why you really shouldn't ignore it. So picture this. You're just brushing your teeth, going about your day, and you notice it, a white or grayish spot on your tongue, or maybe on the inside of your cheek. But here's the thing. It's not a piece of food. You try to scrape it off, and nothing. It doesn't budge. That right there, that's usually the first clue that gets people's attention. Okay, so what are we actually talking about here? Oral leukoplakia is the official name for these stubborn white patches. They show up on what's called the mucous membranes, that soft, wet lining inside your mouth. They can pop up pretty much anywhere in there, your tongue, your gums, you name it. Now, this is absolutely the key takeaway. It's what really separates oral leukoplakia from other things, like oral thrush, for instance. Those other conditions might also cause white patches, but with leukoplakia, the patches are like fused to the tissue. This is a huge deal for identifying it. You simply cannot scrape them off. So, if you've spotted a patch like this, the next logical question is, right, where did it come from? So let's play detective for a minute and dig into the usual suspects, the common causes, and what exactly you should be looking for. While there's no single cause for everyone, the main culprit is usually some kind of chronic, long-term irritation. And the number one trigger? Tobacco. Smoking, chewing, it doesn't matter. But other things can play a role too, like drinking a lot of alcohol, having dentures that don't fit quite right, or even just a nervous habit like constantly biting your cheek. And when it comes to what they look like, well, it can vary a lot. We're talking about those classic white or grayish patches, but they can be flat and smooth, or they can be kind of thick and rough. Sometimes they even have these slightly raised edges. No two cases look exactly alike. One of the trickiest parts about this whole thing is that a lot of the time, these patches don't hurt at all. And because they're painless, it's super easy to just ignore them. But sometimes they can get a little sensitive to touch, or you might notice a little zing when you eat spicy food or drink something hot. Okay, so with all this in mind, trying to figure this out on your own is, well, it's not the way to go. The next and most important step is to get a professional to take a look. Let's talk about how doctors and dentists figure out what's really going on. And honestly, our source material couldn't be clearer on this. If you see white patches that are just hanging around, you've got to go see a professional. These things don't just disappear on their own, so getting it checked out early is really the best thing you can do for yourself. So, what actually happens at the appointment? Well, it's usually a two-step process. First, your doctor or dentist will do a really thorough visual check. And if they see anything that makes them go, they might suggest a biopsy. Now, that word can sound a little scary, I know. But it's actually a super simple procedure where they take a tiny little piece of the tissue to look at under a microscope, just to see if there are any abnormal cells. Once there's a clear diagnosis, the conversation shifts. We start looking at the path forward, which means exploring treatment options and, just as critical, figuring out how to prevent any more trouble down the road. So what happens next really depends on what that biopsy shows. For a lot of cases that are low risk, it might just be a wait-and-see approach, just keeping a close eye on it. But if they do find abnormal cells, something called dysplasia, then surgically removing the patch is usually the next step. Sometimes they might also prescribe medications to help cut down on whatever's causing the irritation in the first place. All right, let's just get to it. The elephant in the room. The one question that's probably on your mind right now is its connection to cancer. Let's tackle that head on. And the honest answer is yes, in some cases, it can be a precursor to oral cancer. Now, it's really important to note that most of these patches are benign, they're harmless, but that potential is there. And that's exactly why getting a professional diagnosis and keeping up with regular checkups is so, so important. This is not something you want to just wait and see about on your own. All right, to clear the air on a few things you might have heard, let's do a quick fire round and separate some common facts from fiction when it comes to oral leukoplakia. Okay, first up, can you catch it from someone? Let me be 100% clear on this. No, absolutely not. It is not contagious. This is your body's reaction to some kind of irritation. It's not an infection, and there is no way you can pass it to another person, period. So this might all sound a little serious, but here's the good news. There's so much you can actually do to take control of your health. When it comes to oral leukoplakia, your best defense is a good offense. Prevention is your strongest tool, for sure.
So what can you do? Well, here are the heavy hitters. If you use tobacco, quitting is, without a doubt, the single biggest thing you can do for your oral health. On top of that, cutting back on alcohol, keeping up with brushing and flossing, and, this is a big one, actually going to your regular dental checkups are all game changers.
When you boil it all down, think of oral leukoplakia as a warning sign from your body. It's basically flashing a light and saying, hey, there's some irritation here that we need to deal with. It's a call to action, really, telling you to go get it checked out and to start being proactive about your oral health. So, as we wrap this up, just remember that you don't have to change everything overnight. Even one small change can have a huge impact. So I'll leave you with this question. What's one small step you can take, starting today, to put your oral health first? Whether that's finally deciding to quit a habit or even just picking up the phone to book that dentist appointment you've been putting off. Every little bit counts. Thanks so much for tuning in for this explainer.